Hey guys, good evening. Michelle Perro here. Zoom, I've muted all of you. I have not muted myself. Sometimes I feel like I should. And I'm going to be speaking this evening on German biological medicine, also known as bioregulatory medicine. And I would tell you a little bit about how I got into this stuff just briefly, because I've only been using it for the past 8 years, maybe 10 years or so. I'm a homeopath by training, an MD for a long time. I'm old, been here doing this oh my God, 4 decades almost. So the reason why I got into it is because I used to practice constitutional prescribing and a lot of acute prescribing. That was my favorite. I had my own urgent care where I prescribed Western and integrative medicine along with a lot of acute homeopathic remedies. And when I went over to Sutter at the time, I was working for Sutter in the integrative health clinic there, I realized very quickly that I wasn't going to have time to do constitutional remedies. And I fortunately had the excellent good fortune of being contacted by not doctor, I call her doctor, she should be Judy Loring, who does practitioner support for BioResource, and they are the folks that sell a lot of the remedies that I'm going to be talking about this evening, and they're up in Katati. And through Judy and learning about these remedies over the years and then using them widely, it literally transformed my practice and allowed me to practice homeopathics in a way that is very relevant for now, because it really focuses on the terrain. Just focusing on whatever viral or bacterial or fungal infection doesn't work. And we have to focus on cleaning the terrain as well. And without that dual approach, in my humble opinion, infection treatment is often minimally effective or not effective at all, as many of you, my colleagues, know in treating chronic Lyme infection and TBI. So this is a practitioner support. I'll be speaking medical jargon, and however, the content is basic. So I'm going to share my screen with you, and I'm going to bring up my talk, and I'm going to get that going and move that over. So again, here we are, basics of German biologic medicine and clinical applications. This is a clinical talk, and that's what I focus on. This is just with a little bit of data and a few studies. So why don't you want to advance? Okay, that's how we advance. Yes, this is my brain most days, and one of my favorite authors, certainly somebody who I like to quote regularly in my practice. So in order to elevate the content of my talk, I refer to a lot of smart people. I refer to this guy a lot. As a matter of fact, I would love to make an appointment to go see Hippocrates. But he really was not only the father of medicine, but the father of homeopathic medicine, because Hippocrates said, quote, "By similar things a disease is produced, and through the application of the like is cured." So like curing like. So this is really the basis of homeopathy. I'm not going to be teaching a lot about the principles of homeopathy, just kind of very lightly glossing over the surface. Again, a basic talk. So this is our guy, homeopathic guy, Dr. Samuel Hahnemann. Those of you might know Hahnemann Medical Center in Pennsylvania. At the turn of the century in San Francisco of the 20th century, there were nearly 900 homeopaths practicing in San Francisco, by the way, and in, I think, UCSF, Boston College, there were many hospitals were homeopathic, FYI. But he is the father of homeopathic medicine, and Samuel Hahnemann said, "The highest ideal of cure is rapid, gentle, and permanent restoration of health and removal or annihilation of the disease in its whole extent in the shortest, most reliable, and most harmless way on easily comprehensible principles." Super cool. So Dr. Hans Heinrich Reckweg, he is the father of homeopathic medicine and homotoxicology. And Dr. Reckweg, he was an MD, he was also a homeopath, and he proposed some following ideas that really have become part of the idea of German biologic medicine or bioregulatory medicine, which is what it's also called. What he proposed was that when you suppress the body secretion process, i.e. with pharmaceuticals, it transfers illness into organs and biologic systems. And the body, as a result, produces what we call homotoxins. These homotoxins impregnate cells and cause eventual degeneration from chronic poisoning. So that's what the German biologic medicine is based on, is this idea of homotoxicology and impregnation of cells with toxins. And for the sake of this talk, I'm going to call them all toxins, even though toxins refer to biologic toxins, and toxicants are involved with non-organic chemicals. So we all know it's making our patients sick. You've heard me yak on endlessly about GMOs and glyphosate, but really the toxic soup that our patients are exposed to is profound. And so this is what we're dealing with. And, you know, if you want to know why we're also sick from COVID, you guys all know it's because our cleansing mechanisms have poisoned. The organism is poisoned, and all our functions, not just immune function, renal function, kidney function, etc., have been, kidney, lung function has been poisoned by, you pick it, just about everything. And this is, as you know, an incomplete list. So with German biologic medicine, we use drainers, and what we're doing are treating the terrain. Like Beauchamp said, you know, this is not a new concept. This has been around forever. I didn't invent this. Reykjavik didn't invent this, but we're trying to clean the terrain. A little bit of what this terrain looks like, because as an MD, we never learned about terrain or extracellular content of cells. So cells are embedded into protein, carb, fat, water. Oh, just like everything, like our food, containing extracellular matrix, which is called the ECM. All nutrients have to pass through this complex matrix. So cellular communication, regeneration, detoxification are dependent on the health of the bioregulatory ECM. So what's it made of? There are collagen chains linked by glycosaminoglycans, and there are 4 main gags: heparin sulfate, chondroitin sulfate, keratin sulfate, and hyaluronic acids. And there's spongy hydrophilic molecules consisting of these repeated sugar chains. What they're responsible for are transport of nutrients, storage, such as growth factors, which are important in oncogenesis, and toxicants. They're stored in this ECM. Expression of the heparins in the matrix can lead to hypercoagulability, for example. They're responsible for intercellular communication. Cells need to communicate through the matrix, and cancer separates itself from the matrix by secreting matrix dissolving enzymes. I just found that fascinating and had to throw that in there for you guys, kind of little sidebar. So there's a really important concept in German biologic medicine, is this idea of regulation capacity. And that's the measurement of a person's ability to react. And the key to health is the ability to regulate. Too much energy can be expended if the organism keeps trying to get to homeostasis. You block up the cleansing mechanisms and the whole thing shuts down. Sink overflowing, dirty goldfish bowl. Water, 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 a little eye candy for those of you who like this kind of thing. Well, you know, it's getting late in the day. So we don't drink enough water. I just bring my water wherever I go. And the ECM needs to stay hydrated. And a huge problem is just not enough water. How simple does it get? Nearly 50% of the average Americans' increased caloric consumption is from sugar-loaded beverages. No surprise there, in little plastic containers. Woohoo, we don't want that. So, water. If you learn nothing from this talk, you're going to go back and drink water. So the extracellular matrix is the area between cells. I am getting, maybe people cannot get into the talk. Uh-oh, people are waiting in the waiting room. So what I'm going to do for a second is I'm stopping the talk and letting people in. Hold on, folks. Let me just go. Hold on. Sorry for that. There are people waiting in the waiting room, but I don't know how to get them in. Participants. Okay, admit. There we go. I'm just admitting you folks. Okay. Let's continue. Sorry for the disruption. And put yourselves on mute. Thank you. Okay, we'll continue. So here's a picture of the matrix. Theirs is what it looks like. For you visual learners, I like to see what I'm dealing with, and that's what visually what it looks like. What's interesting is that we don't have, a cell wall like plants do, but we have this matrix that provides some of the same support. So that's kind of what it looks like. There is a components again. Cells secrete these glycoproteins, the main component of the ECM, and all three of these are common ECM glycoproteins, just another kind of visual. And this is really important to understand the mechanism of how these remedies actually work, and this is where they work. So this is what I find interesting, because collagen is the most common glycoprotein in the ECM. And just FYI, we know that glycine is the most common amino acid in collagen. And just for those of you who know me, you know I talk endlessly about glyphosate. Glyphosate and phosphoenolmethylglycine. There are some really super smart people like Stephanie Seneff and others who have proposed that is it possible that glyphosate, the most ubiquitous herbicide in the world, is swapping with glycine and now in our collagen. I say clinically, yes. Whether it's been studied and adequately shown, I say no, but I worry about that as well. And that's why people are so doughy. When you feel a patient these days, they just feel so doughy. And this is what I worry about, or they're just sitting on their butts all day in front of their screens doing Zoom like we are, is also a possibility. So again, to Hippocrates, I'm just trying to elevate myself, elevate all of us. Natural forces within us are the true healers of disease. Yes, we all know that our chi, our vital force, is what we call in homeopathy, has to be resurrected, and we really can heal ourselves. So let's talk further. So the body's attempt to regain homeostasis against dysregulation, disease, depends on the stage of health of the organism. So if our chi, our vital force, is down, right? If that's lowered, it's just harder to regain health. So we're always kind of to revitalize the chi. So Dr. Reckeweg was super smart, and he combined ancient Chinese medicine. He based it on 5-element Chinese medicine, by the way, even though he used homeopathic remedies and naturopathic ideas into this field of homotoxicology. So homotoxins are produced by the body, and they're substances that negatively affect human cells by combining with other toxins. This is important. 2 phases. There's a humoral phase and a cellular phase. The humoral phase is the healthier phase. As we get into past that biologic division, we get into an unhealthier phase. Humoral, 3 phases: excretion, reaction, deposition. Cellular, 3 stages: impregnation, degeneration, and neoplasm. So this homotoxicology model is utilized to define the objective of German biologic medicine and to restore the integrity and function of the connective tissue matrix. The progression of these stages is usually reversible in the absence of significant tissue and organs damage. And that's important to understand, so you can go back and forth. And the goal is to shift from cellular stages, if that's where you are, back toward humoral stages. That's what we're trying to do. So an example of a humoral phase is 1, the excretion phase, food poisoning. You throw up, you have diarrhea. But what do? We give Lomotil and Zofran. Now, occasionally we have to stop the vomiting cycle because it can get a little bit gnarly. I use homeopathics. I tend to use Nux vomica. But, yes, Zofran. I never stop diarrhea. You want to excrete that stuff out. So that's a healthy reaction. Kids who vomit everything up, super healthy. So the next phase, reaction phase in like fever. That's a normal response, right? What do? We suppress fevers with drugs, which can push deregulation to a more advanced state. The body reacts with an inflammatory state, and boy, we have an app for everything. A mom showed me this app for taking fever. I don't know about that, but oh yeah, I guess. So, I can't help myself. I had to pull out a couple of articles regarding acetaminophen and autism. Yes, it could also, there's some studies, because, Yeah, otherwise this is not a valid talk unless I throw a few studies in there. And also we do know that acetaminophen can disrupt the microbiome, and everything is about the microbiome. So yes, and what are we giving patients, kids before vaccines? We give them acetaminophen. We know that, okay, let's keep going. We know that Tylenol depletes glutathione, which is why a lot of ER docs, we use acetylcysteine, NAC. And what's interesting is the other thing that depletes glutathione, do you guys know? I can't see you anyway, and I can't see your hands raising, but yes, GMOs. In a study by Michael Antoniou out of the UK, King's College, he showed that indeed what GMOs do, they deplete glutathione. So imagine we eat a GMO and have some Tylenol, glutathione gone. So deposition phase, things are getting a little bit gnarlier. When the body's defenses cannot expel completely these toxins, they become encased in the mesenchyme, the connective tissue, adipose tissue, vascular system, and homotoxins are locked into the tissues where they can't cause more damage. Unpleasant, yes. Life-threatening, not usually. And they can really embed in here, and they get a little harder to clear. Nothing harder to clear than fungal sinusitis, right, folks? How hard is that? So even though we're on the upside, right, of our line, of our cellular division line, things can get a little bit harder to treat. A little humor. So let's get into those cellular phases, and there are three. And the first one is the impregnation phase. And this is more complex to treat than the previous phases that I just showed you, but still is reversible. And these deposited toxins can interfere with enzymatic functions. And what's really interesting is the symptoms, such as eczema, appear unrelated to the original cause. So when I see eczema in babies, I'm thinking, uh-oh, gut issue. You show me eczema, gut issue. If you have a gut issue, you don't necessarily have a skin issue. It doesn't necessarily work that way. We get into the degeneration phase. Organ structure and function are increasingly and often damaged irreversibly. And there, like we can see chronic fatigue syndrome, it's a multimodal approach. It requires laminate therapies. Everything starts to get overwhelmed, and you can see where we're going now. And I think if there's no integrative doc who hasn't treated chronic fatigue, it's ubiquitous in our communities, and we're really starting to treat everything. This is not what we're going to be talking about tonight, is treating these complex diseases. But yes, you can treat complex chronic disease with German Biologic Medicine, yes. A shout out to this gal. I don't know her, love her. She has great YouTubes, great book. If you haven't read that book, I suggest you take a look at that. Sarah Myhill, super smart gal. The dreaded neoplasm phase, new and abnormal growth of tissue. It's obviously, we all know what this is, overrun with oxidative free radicals, damage of genetic material, of course. And I just found this interesting. Over 80% of oncologists surveyed would not use chemo if they or their families were diagnosed with cancer, because chemo is too toxic. And there's Zach Bush on cancer. Most of you are probably familiar with Dr. Bush. And this is another view I like to use of the different phases of humoral, matrix, and cellular phases. And this is another way that we can view homotoxicology. And what you can see is where we go toward something called progressive vicariation. And what we want to do is go back toward this regressive vicariation. And Dr. Reckowig taught healing is a complex biological process and does not necessarily proceed in a linear fashion. These inflammatory processes are a detox mechanism that should not be suppressed. On Amazon, there was his book. It was super chunky, very long, which I did not read, and I read kind of the Reader's Digest version because time. But if you can and you're that person, I would definitely read his book. So I'm going to talk about these remedies I use. They're made in Germany. Germans do really good homeopathy. And we're going to talk about matrix regeneration, regulation, and provocation remedies. There are 3 types of remedies. So basically, These are the three types. The regulation remedies are called the basic drainage remedies. Those are most of the German biologics. Then you have regeneration or restorative remedies, and those are the rest of those remedies. Again, you have one more group, provoking remedies, and there are your provoking remedies. And this is how they are. Most of them come in liquids, and this is how you can dispense them because I'm hoping some of you, many of you, treat children. And if you're treating children, you're going to have to know how to do these remedies for kids and how to dispense them. So I think this company's been around since 1974. It's been around for a while, founded by Dr. Peter Beiersdorf, and it's still operating in Germany. They are sent out by BioResource. I am not receiving any compensation for BioResource for doing this talk today, but I do love their remedies. So, important notes on Pacana drainage remedies. Multiple remedies can be combined in the same protocol. I've given as many as 9 remedies to patients, and that patient was me. A colleague of mine, Dr. Christine Gedrick, gave 11 remedies. They can be synergistic. You can put them in the same filtered water, and I usually give them in an ounce of filtered water. I try to leave the alcohol intact, but if people have alcohol issues, small babies, you can flash it off with boiling water, or you can let it sit for 5 minutes after you flash it, or you can leave it out overnight, let the alcohol evaporate, and then give it the next day. So when you're using gut remedies, you dose 15 minutes before or after a meal, and away from meals otherwise. Now, before you pour the remedies, you activate them. That's me succussing the remedy. By the way, I'm getting some more messages from folks. Let's see. People cannot seem to get in. So again, I apologize, and I must have put my settings wrong. Let me just cancel this. And get back to Zoom and let people in. Hello, people. Sorry that I'm having to stop this, and I must have put in some setting wrong. So I apologize for that. My bad. Let's get back to the talk, and I will play that. Okay, so that's it. I'm not letting anybody else in. That's the way that goes. So you succuss. These remedies are not made like traditional homeopathics. They're made by a spagyric method where they're actually burnt down and then reconstituted to bring the yin and the yang together. But so then again, that's me succussing, and the energy of the individual who's succussing will transfer the energy of their remedy to the bottle that they're pouring. It's kind of cool. So more important notes on these remedies, those regulation remedies, you give them about 20, 25 drops a day. You can increase the dose for acute symptoms. The regeneration remedies are generally syrups, and we can give them higher doses. I start low and I go high. For example, I'll show you one case where I started a teaspoon, and by the end I went up much higher than that. And then I'll show you how to adjust kids' dosing. And that book, Vital Energy Medicine, which I have open on my desk, I refer to all the time because my memory is abysmal these days. It used to be good. Now it's not so good. I'm probably a few spirochetes holding brain cells together. And Dr. Tom, who has a bioregulatory clinic in Scottsdale, wrote that book, I think it was maybe a year ago, and a very good book. It's a small little manual put out by Chelsea Green, a great read. And then there's another remedy guide for those of you who need more stuff, and I highly recommend you download the remedy guide on the bottom of your screen. So these combo kits are crucial. That first one, detox kit, is almost in every one of my prescriptions to detox people. When I do it, it's the art of practice, but inevitably I will detox. And that's liver, Iteres is lymph, Renalix is kidney. And people overlook lymph all the time, and these are given together, and you can give it when, as you learn about the art of the practice, there are times when you should detox, and all of you know that just from treating patients integratively. That stress buster kit might be a key kit to give during COVID. Delectro is a mineral solution. And it's maybe the equivalent of like a bioplasma. Some of you may know that from Highlands or cell salts. Neurigen is for a depleted state. Inside Stabil is for psychic disruption, psychic breaking, psychic instability, and just stressed out. So that was like my best mom combination. I had a lot of moms when I know, I'm just saying, folks, there were a lot of women in my practice. Matter of fact, I hardly saw any guys, no dads, maybe one. I've given that kit. Yeah, one of the goals is to get more dads involved with care, because what often happened is I would start with mom, and visit 6, dad would show up and not want to hear about all the other stuff we had been doing and questioning everything. So dads get in right from the beginning. Okay, here's my doctor, Dr. Hippocrates. I want to make my appointment online. So now I just want to do some simple cases. These are straightforward cases. So and this is how I would do it. And this is how I have done it, because these are all my patients. So a 30-year-old gets constipated every time she travels, right? 101. Mundipore, a teaspoon BID. Eventually that didn't work. I had to go up to a tablespoon BID, especially the evening. Success, done. If it's not quite working, you can add in another remedy called Defeton. It's still an issue. Nobody gets treated until they're pooping, period. So a family's traveling to Mexico, case 2. They want a remedy for traveler's diarrhea. Okabaka, it's made from a bark of a tree from Africa. I often add in this remedy. It's one of my favorites. It's apohepat for liver support. The German Biologic Medicine believed that liver was like the key organ. You can believe that or not. And apohepat is brought in a lot to your prescriptions. If there's cramping, nausea, abdominal pain, you can use apoenteric. Now, back in the old days, I might use arsenicum album. You know, for traveler's diarrhea for liver, I might use lycopodium or chelidonium majus. For cramping, I might use colocynthis, cuprum, a lot of good crampy remedies, even chamomilla. So, I mean, you can go back and forth. And I've also used, for example, let's say a kid with diarrhea, I might use arsenicum and okabaka. There's no reason why you can't blend traditional homeopathic homeopathic prescribing, and, well, constitutional also, and German biologic medicine. Okay, how are we doing so far? We good? Okay, have a sip of wine. I mean your water. Did I say wine? I meant your water. Case 3, your 45-year-old husband's leaving town and he's having IBS, stress gastritis. What do you start? Juvical, Apostom. Look in the back seat of his car, folks. Toss the Doritos, those little GMO corn chips, get rid of them. And I love Apostom. Just about every gut case that I've ever done, I start with Apostom, Juvical, or Mundipore. They were the cornerstone of most of my gut cases. Most of my patients, I start with the gut. It's rare that I didn't. So this is a finite amount of information to learn in German Biologic. You could actually master it. Imagine how many pharmaceuticals there are. You just can't even master it. But this is it. These are your gut remedies. And since most people have gut issues, you're going to be referring to these remedies a lot. And I won't go through all of them, but you can just see what they are. But I do want to say that you pair a lot of things with Apostom. That is a great remedy, and you do a lot of pairing with Apostom. So I would use that a lot of my prescriptions. But you can see here, this is it. We can actually do this. And coupled with the book in my hand, I can prescribe almost just about anything. Okay, you need to know about this remedy, Opsonat. It's a flagship remedy. When the guys came from Germany and they spoke, they said all the German patients were on Opsonat. Well, I don't know if that's what we need, but anyway, inflammation, Opsonat. I have taken myself this remedy, especially when I had a lot of dental caca, that this was one of my favorite go-tos. It supports immune function and it's good for itis. And this was developed by Dr. Beiersdorf, the guy who started Pocana. For any itis you have, you can go with Opsonat. Now, if you go back to your slides, and you're all going to get this presentation because I'm recording it, that you go low and slow, and this is a provoking remedy, so you want to start low and slow. I usually start low and slow now, especially for sensitive patients, because who doesn't have a chronic disease and who's not sensitive? just about everybody. So let me give you some simple breathing cases. I want to talk about breathing remedies. Are we all still breathing? Am I breathing? I kind of just yakking at you. Okay, let's talk about this case. 8-year-old asthmatic boy. He's on albuterol and Qvar. He has a mild flare from a URI. You begin Perro. That's a great asthma syrup to his regime. It's a regenerative remedy. And take out the dairy from his diet. You added high dose vitamin C and D, and he's much improved. And so what I say is, I'm talking, I'm teaching. I can't come. I'm sorry, someone's trying to get into my house, but I can't come in. This is the life of a Zoom lecture. Yes, indeed. Pardon me, folks. So someone might say, well, Michelle, why don't you just do a COVID case? Well, I haven't taken care of any COVIDs where I've actually prescribed these remedies. So I don't think that's fair to say, oh yeah, I use this in COVID. Well, I haven't done it. I've just used arsenicum album in one patient. So, but if I were to create a protocol, which I'm going to do by the end of tonight, Perro would be in my protocol, along with arsenicum album and a few other things that we're going to get to. Okay, so much improved. Case 2, your kids are sick, and now you have a scratchy throat and chesty cough. Your in-laws are coming to town. That's like a disaster right there. Get the Cystabil out. Oh, I did get it out. Apopulm, Cystabil, vitamin C, curcumin, deep prayer, glass of wine, you're much better. So you can see how I'm combining this stuff, but hey folks, I didn't forget the usual vitamin C, vitamin D, curcumin, whatever's in your toolbox, whatever you like to do, meditation, prayer, avoidance, whatever your solution is, bring that in, and then you bring these in as well. So I'm still doing all the other modalities of nutraceuticals, herbals, occasionally pharmaceuticals, and homeopathics, and that's my cornerstone. So here are the breathing remedies. Apopulm, if there's mucus. Apotuss, acute coughs. You can combine that with the other two. Perro, great for asthma, pertussis, and it combines well with these immunomodulators, and I'm going to talk about those in a minute because those are key, and that's what I would use now for COVID. Is Subtisan, and I'll show you what those are in a minute, and my Cobasan if I was treating these lung patients. Faux show. I just want to talk about these heart remedies. I don't want to go into all of them what they are. That's not basic. If you're using heart remedies, you're not probably doing basic German biologic medicine. But okay, when I was having some cardiac stuff, I use Corocalm as a cardiac sedative, like for tachycardia or issues in circulation. And if someone's really anxious, like now, you can use Corocalm and combine it with Cystabil or some Cupin if they're having trouble sleeping at night. And I'm telling you, that stuff works like a charm. I had an anxious friend who had insomnia. I brought in Corocalm with some Cupin, slept like a baby. And it's homeopathic. And it doesn't interfere with the other treatments that you're using. So there are different ways, even though you say, wait, Michelle, heart remedy, why am I doing that? But the heart talks to the brain, right? The heart has its own heart to brain nervous system. And I love Thomas Cowan and Human Heart. Have you guys read Human Heart, Cosmic Heart? Oh my God, right? So Corocalm. And if you have toxic foci, cardinorma, infarct patient can goose. I said I wasn't going to talk about them, and well, I did. Okay, moving on. You can see, I just wanted to show you that if you're treating children, not cheating them, but treating them, this is what you're going to use for liquids, for syrups. You can increase the dose, as I said, for acutes. You can take them directly or in a small amount of filtered water. Okay, and I tend to take mine in water. If a patient can hold it in their mouth and get it under that little blue vein in their tongue, that's great. In nursing mom, she can take the remedy, which will get passed to the baby. You can also put the liquids on directly, either in a cream or directly in the skin. They're not irritating, like whether it's on the forearms, behind the lobes, soles of the feet, the tummy. Those are all the places where you can put the liquids directly, especially if you get a kid who won't take the stuff. Some kids are so incredibly picky. Yes, indeed. right? COVID. Okay, moving on. That's from Green Med Info, I think. So I want to talk about these immunomodulators. These are not drainage remedies. These are homeopathic fungi and bacteria. And these remedies have been the reason why I've been able to reverse some patients with autoimmune disease and get deep-seated diseases. But I've used them for just mild infections or more severe infections as well, even if someone doesn't have a chronic disease. But honestly, 1 out of 2 kids has a chronic disease. I think it's more adults than that have chronic disease. So just like everybody has chronic disease. So again, they're called isopathic remedies, but they're not drainers. They aid in downregulation of inflammation. They can reprogram cell metabolism. I told you they're fungal and bacterial derived, and very helpful with acute illness and inflammation. And remember, the primary goal of this therapy, we want to enhance overall immunological reactivity in case of suppression, i.e. from Tylenol, balance an overactive excessive immune response, i.e. allergy, food allergy, other things. Do I even dare say vaccinations? No, I didn't say vaccinations. To restore healthy, normal immune function. The cornerstone in treatment of chronic immune dysfunction are these remedies. And if you have a sensitive patient, you go low and slow. That's my theory. Go low and slow. Start low and slow. You don't need to bomb them. Meet Dr. Gita Jensen. I always want to say Gita Jensen. It's so beautiful. But she's a researcher, and I think she's up in Oregon. And she published this article, so it's kind of old now, about these immunomodulation by San Pharma fungal metabolic products. And it's one of the few studies that there is on these products. And she was in cancer research, but she did one cool study. And even though this is mostly a clinical talk, I just want to share this one study, because a lot of folks will ask you, where's the data? Show me the research. Like the last 5,000 patients you have just taken care of, not enough data. Those are just anecdotes. Remember that. Okay, so what did she find? Her study looked at the immunology of these San Pharma isopathic remedies. And she showed that penicillium notatum, and I'll talk a lot about that penicillium, reduced baseline COX-2 expression in vitro. The fungal metabolites did not induce COX-2 in human monocytes or neutrophils, indicating an anti-inflammatory effect, and was actually as good as dexamethasone, by the way. It induced a downregulation of systemic inflammation and modulated hyperactivity. It was an activation without mitogenic, inflammatory, toxic effects. All fungal metabolites tested were able to activate NK cells. So this would be my go-to in COVID, is to bring in penicillium notatum, yes. And a couple more things there. It can take an immune system out of energy, as many of our TBI patients. It can either decrease a immunologic state or bring one out of energy. And now this stuff was looked at cancer strategies, but this is just really good stuff for immunology in general. And just as a reminder about pharmaceuticals, because I had to go back and review, like, what does aspirin and NSAIDs do? Like, yeah, it's been a while, because I hardly use that stuff anymore. I mostly use homeopathics or, my other immunomodulators, whether herbs or, curcumin, etc. So aspirin and NSAIDs, they inhibit both COX-1 and COX-2. COX-1 enzymes are present in a variety of body tissues, including sites of inflammation and the stomach. And we know they all can cause stomach upset and ulceration. COX-2 produces prostaglandins in areas of inflammation, but not the stomach. And COX-2 inhibitors do not have the same effect on the stomach and intestines, like Celebrex. So this is a little bit of review here on what we're actually trying to do and what pharmaceuticals do. Now, I wrote this up to show you how they're supplied. And I cannot remember what comes in what form, so I have to go back to this all the time. I have taken photos of this and have it in my phone to remember which are drops, which are capsules, which are, suppositories. And so just a quick review, the drops are most sensitive, and you can use them topically, orally, intranasally, oral as an ear, and in a nebulizer. And you can give it 1, 2, 3, 4 times a day. Kids, I use a lot of these drops, the Notosan drops. The capsules are fungal, 4X, bacterial remedy, 6X, and they have a really strong effect on liver and the gut. And for kids, you can open them up and put them in water. Now, you can do it twice a day to once a week, depending on the sensitivity of the patient. The most common fungal remedies we use are penicillium, either Penicillium notatum, Roqueforti, and quentans, and you take them more frequently than the other fungal remedies from mucormycosis, aspergillosis, and Candida. And the penicillin remedies can be taken in patients with penicillin allergies. I get that question a lot. The bacterial remedies, and they come in capsules, are taken less frequently, like once to 3 times per week. The strongest form are the suppositories, and they come in a 3X. And you can use the suppositories rectally and vaginally, like for bacterial vaginosis, and you could also put them directly in the mouth if you've got a dental foci and you want to remove foci, whether it's in the cavitation, a heart focus, a sinus focus, you want to get rid of the foci. And I like them at bedtime where they do their magic. You can alternate nights, and you want to give respite from these remedies. So I usually do 3 to 5 nights on, 2 nights off. Anywhere to 2 to 4 weeks is how I do it. Now, here they all are. These are all your fungal products. That's it. 1, 2, 3, 4, 5, 6, 7, 8. Now, you want to go to the bioresource website periodically because things change and they're coming from Germany, and sometimes things can't get into the country, or they can. So periodically you have to take a peek at the website and see what's still available. And this, I don't need to go over all of them, but you can see, whether it's metabolic dysregulation or fungal who doesn't have like a mold issue right now, right? Like everyone. Mucor, I took that a lot because I had a hypercoagulable state. So Mucor was my savior. Notasan is my workhorse. I'll talk a lot about that in a minute. And infections, quentasan will be my go-to in terms of like recurrent herpes. I've used quentasan in a liquid right on top of herpes, super good. Dysbiosis, Roqueforsan, and intestinal, Candy Roxan is great for dysbiosis. So you could take a picture of that, and that's it for your fungal remedies. That's all there is. That's all you need to know. And once you start using them, you get familiar with what they do. You have to play with them a little bit. And I definitely recommend, if you're going to get into this, do the practitioner support with Judy. Judy Loring is her name. She's amazing, and she'll give you a lot of tips of the trade. And I have to remember how they're supplied. I don't remember which are drops, which are spray, because I treat a lot of kids, so I use a lot of drops and creams. I don't use suppositories much as in kids because they don't like things in the tushy, but grown-ups don't like things in the tushy either. But if you really want a big download, especially if there's intestinal permeability, dysbiosis, the suppositories are the way to go, and you get a big download. And those are all how they're supplied. So that's that. And you can see that and use and take a picture if you need to. So the other beautiful thing to remember is in the beginning of any case, you combine remedies, and you frequently combine the penicillium remedies. And these are the common ways you do it. So I might give Notasan and quentasan to down-regulate systemic inflammation, clean up infection. Beginning of a case, a pneumonia, a UTI, I'll use Notasan and quentasan. When I have inflammation and infection in the gut, I'll go to Notasan and Roqueforsan. That's Penicillium Roqueforti. If I have infection and metabolic dysregulation, I might use quentasan and Roqueforsan. And you have to say, oh my God, what do I use? Well, you got to have to start to play with it. And what does the patient have? And that's where you start. You might take both capsules together 3 to 5 times a week, away from food at bedtime. And again, I do respite on the weekends. I give people a break. So the Notasan is the first remedy to be used. Notasan. If anything you remember from this lecture is Notasan. And I bring it in almost in every case I start, because it also, not only is it anti-inflammatory, if there's any autoimmune component, it starts to re-regulate an autoimmune issue, and it nudges the site out of energy. Quentasan, I think infection. Notaquentan spray, sinusitis, dental infection, you can spray it right to where it needs to go. And the dysbiosis, that's my favorite combo, Notasan and Roqueforsan. So we put 2 to 3s together. I don't put all 3 together. And that's the kind of how I do it. And I mentioned the pulsing. They like to be pulsed. So moving on. Oh yeah, the blue pill or the red pill. These get into a little more challenging and a little more serious, and these are not easy cases. Are there any, is there such a thing as an easy case anymore? I don't think so. Anyway, Firmosan, I've used it only a few times in my own treatment. I use it in osteo. I've used it for myself when I had some osteo issues and my dental infections. And you kind of give it like once a week. And it's Firmosan. That mycobasan is what I would use now for COVID. And it's an immune regulating remedy, bacterial derived remedy. It focuses on malt and viral infection. So I probably would bring in like Perro, a remedy called ApoInfect. I've not told you every remedy there is, the Picana drainage line, and a mycobasan is what I would probably do, something like that, and probably Notasan too. So that would be how I would approach a COVID patient, something like that. The Suptasan is from Bacillus subtilis. I love Bacillus subtilis. I use it a lot. Spores, treating, dysbiosis. I use a lot of spores in my patients. I like spores, spore biotics. It's great for inflammatory conditions and infections. Remember, this is the homeopathic. It's gentle, it's non-specific immune adaptogen. It's similar to penicillium notatum, but a little bit stronger in action. And these are the general guidelines. And that's it. You've got 3 bacterial remedies. How easy is that? That's what I say. I don't know what people are saying. So, a couple of simple cases on the San Pharma remedies. Okay, how are we doing? We still good? Can we hang 10 more minutes, folks? You can phase out. I will send this to everybody who wants it. This is just for you guys. 2-year-old girl with ear pain. That's like every other kid. She had no systemic toxicity. I gave her Notasan drops directly in the ear, and with Otodola, which we don't have anymore, vitamin C and D, and a prescription for antibiotics to hold. That's what I did. The next day she was better, but I took some heat from the primary care doc. I can tell you that because I didn't treat her. Yes, these are true stories, people. 70-year-old guy, he has shingles. He didn't want to take antiviral antibiotics. You gave him quinasan capsules, TID. Dirt cut, it's a topical. It's great for eczema, acne, viral infections. I gave him some lysine. I gave him some topical calendula because they looked inflamed, and he did great. Okay, 40-year-old firefighter. He has some asthma. He's on Advair. He's wheezing. Perro, Notasan, BID. I gave him mycobasan, one cap 3 times a week. Took dairy out. My asthmatics are not allowed to eat dairy. And I did the detox kit because firefighters are toxic. Once he was better, I didn't detox him. When he was sick, I waited till he was better and I gave him a detox kit. His asthma got better. He got weaned off his Advair. I took more heat from his PMD because I took him off Advair. True story, true dat. Okay, little 8-year-old. He comes in with his 4th episode of strep. This is a true case. OCD, school disruption, and rage. I gave him a Septonsil. It's a great remedy. I'm about to prescribe it imminently for a PANDAS patient that I just spoke with today. Notasan in his water, BID. And let's see, he did great on that. I also gave him amoxicillin. And I got an extra dose of heat from the PMD for diagnosing a controversial issue such as PANDAS. That is a true story. PANDAS is not controversial. It is a real deal. That's what I was told. And that was just about 10 months ago. So that's Notasan. That's the workhorse. Comes suppository, capsules, liquids. And that's the one I use most often. My last easy case. 30-year-old woman. She has a lateral talofibular sprain, little ankle sprain. Arnica. Yep. Inflammiar. If you don't know Inflammiar, use Inflammiar. And got Dr. Gita Jensen did a great listen on podcast on this remedy, and she did another study on that. That was awesome. Apodolor, it's for pain, and I did meat. I don't do rice. I do meat because I'm keto. That one's for you, Bonnie. movement, exercise, analgesia, alternating heat, and ice. I don't even hardly use ice. I just use heat, and acupuncture. Better, I swear, like in front of my eyes got better. And how is that? How cool is that, right? It's amazing. I know. You love this stuff. You just can't even believe that everyone's not doing this. So there is that medication guide. I want to make sure you all saw that. It was written. It's been written a while ago, but it's still relevant. Gary Klepper now practices in Colorado. He's just brilliant on this stuff. I've listened to a lot of his recordings. There are a lot of recordings, by the way, for those of you who don't do the practitioner support on BioResource, and you'll hear me yak on too on a few of them. So, diet, come to this group. You can choose the best remedies and the patient still gets stuck. So we're constantly working these cases, and I'm constantly changing the formulas, looking constantly for the root cause. But I can tell you, if patients don't change their diets, they just don't get better. And you all know that. I don't need to tell this crowd. That's me. If you need to reach me, that's the best way to get me. There's our book, because it's a shameless plug for the book. But when I spoke to Mike Sheehan, who's the owner of BioResource, he said if anybody listened to this talk and wanted to get into these remedies, he would give 10% off. I said, okay, fair enough. So I'm going to stop my share here. I'm going to escape there. I'm going to just close that, get back here. And if anybody has any questions, I think you can type them in if you want. I think, can you? I don't know. Maybe. Anybody have any burning questions? I could put you off. I can unmute you also if you have a burning question. Otherwise, we're going to wrap it up. I'll wait a second and see if any. From Carolyn. Hey, Carolyn. You're so welcome, my friend. I hope that was helpful. I'm just really trying to be helpful and not be a pain in the tush. And hopefully you've learned something that will help your patients. Otherwise, what the heck are we doing? Anybody else? Any other thing burning? Desires, life issues, relationship problems? Okay. Well, on that happy note, I'm going to say thank you all for coming. Love to you, Bonnie. Thank you all for coming. And any questions, just email me. I'm happy to take it offline and email me. I'll do the best I can to answer any questions that you may have, or we can learn together. Can I have the slides? Yes, you can. I'm going to send you the slides. Whoever wants the slides can have the slides, share them, use them, and enjoy them. I will send them out. Bonnie's going to get a copy. Whoever else wants slides, you will get copies. And thank you all, by the way, for everything you all are doing with all your toolboxes, treating every God knows what complication, COVID and everything else. And I appreciate all of you. So on that happy note, slides, please, from everyone. Anyone who wants slides, you get slides. Lots of love, you guys. Stay well. And I really appreciate y'all coming. Thank you. Hugs back, my friends, hugs back. I'm going to stop the recording.